First aid. Exploring the knowledge, attitude, and the practice of first aid among rural women offers valuable insights into the challenges they face in emergency response and the potential for the community health improvements. A comprehensive understanding of these factors is critical for designing targeted interventions that can empower rural women to respond effectively to medical emergencies. Knowledge of the first aid, the awareness and the basic understanding. In many rural settings, women's knowledge of first aid is often limited to very basic information or influenced by traditional belief and practices. For instances, they may have heard about the something important of stopping bleeding or cooling a wound, but may lack in a detailed understanding of how to perform these interventions correctly. Specific first aid scenarios. The knowledge gaps are particularly noticeable in specific scenarios such as handling fractures, treating wounds, performing CPR, or managing choking incidents. Studies often find that rural women have little exposure to systematic first aid guidelines or life saving technique, limiting their ability to act effectively in emergencies. Source of information. Information about first aid in rural area is often passed down through family members, elders or community traditions, which may not always align with medically accepted practices. Health education is typically limited in rural areas and formal training programs in first aid may be rare or inaccessible. Challenges in formal education. Socioeconomic barrier, lower literacy rate, and limited access to health information contribute to a lack of formal knowledge in rural communities. Women's role, particularly in rural areas, are often confined to domestic and caregiving duties, which might restrict their access to structured educational opportunities. The perceived importance of first aid. The attitudes towards first aid can vary widely among rural women. Many view first aid as essential for safeguarding family members and the communities, especially for the children and the elderly who may be more vulnerable to injury. However, the emphasis on the first aid importance can be influenced by prior experience and medical emergencies. Self efficacy and confidence. Even if rural women understand the importance of the first aid, they often feel a lack of confidence in applying it, fear of causing harm, legal concern, or a sense of inadequacy may prevent them from acting in emergencies even when they know basic procedure. This agitation can delay timely intervention, which is crucial in the emergencies. Role of gender and community dynamics. Cultural norms in the rural area often place women in caregiving role, which could positively influence their attitude towards learning first aid if given the opportunity. However, gender role can also present challenge as some communities may prioritize male education over female, leading to fewer resources for women skill development. At trust in traditional practice. In rural settings, there is often a high degree of trust in the traditional or home based remedies. Some women may believe that local herbs or cultural practice are sufficient for treating injuries, which could diminish the perceived need for formal first aid knowledge. However, these reliance on traditional remedies can a barrier to adapting medically recommended first aid practice. Practice of the first aid. Community level response to emergencies. In emergencies, rural women are often the first responder within their household. However, without proper first aid training, their response are limited to the knowledge and material available at hand. This often include actions like pouring cold water on wounds or applying pressure to bleeding wound, but rarely extend to more structured first aid technique. Access to first aid kits and supplies. In many rural households, basic first aid supplies like antiseptic, bandages, or pain relievers are often unavailable due to economic constraints or lack of awareness. The absence of first aid kits limit women's ability to manage injuries promptly and effectively, increasing the risk of complications. The use of home remedies and traditional approach. It is a common for rural women to rely on the home remedies such as applying turmeric or other natural ingredients to wound. While some of these remedies may be harmless or even beneficial, others can be ineffective or worsen the conditions. This practice indicates a lack of access to basic first aid supply or knowledge about safe alternatives. Transportation and access to healthcare. For serious injuries or complications, the ability to transport injured individual to healthcare facilities is another major factor. Rural areas are often have limited transportation options, and in absence of the immediate medical help, the importance of accurate and effective first aid become more crucial. The barriers to improved first aid knowledge, attitude, and practice. Educational and resource barriers. Access to first aid training is limited in many rural areas due to lack of resource, trained personnel, or logistical challenge. Socioeconomic factors further hinder access to healthcare education, as many rural families prioritize daily needs over educational expenditures. Cultural and social influences. Traditional gender role and cultural norms sometimes act as a barrier to women's participation in health training. In some rural areas, women might not be encouraged to step out for traditional caregiving role to pursue formal education or training in area like first aid. Institutional support. Although there are health programs in place in many rural areas, they often focus on primary health care and maternal child health rather than preventive health education or emergency response skill like first aid. The recommendation for the enhancing CAP or first aid knowledge, attitude, and practice. Community based first aid training programs. Creating first aid training programs tailored for rural women can empower them to respond effectively in emergencies. These programs can be implemented through local healthcare centers, women's self help groups, or with the support of NGOs. Training should focus on the practical, culturally sensitive, and accessible skill that can be applied in everyday scenarios. Awareness campaign and the information dissemination. The campaigns that raise awareness about the importance of first aid could help change attitude and increase community support. For instance, educating rural women on common injuries, quick response technique, and the myths about traditional practice can promote evidence-based practice. Integration into existing health programs. Integrating first aid training with other rural healthcare services such as maternal and child health programs, ASA workers, and the Anganwadi centers can ensure regular access to first aid education. This integration would also create a sustainable support system for reinforcing first aid practice. Distribution of basic first aid kits. Providing basic first aid kits to rural household along with training on their use could enhance emergency preparedness. Government health initiative or NGOs could subsidize these kits, making them accessible to low income families in the rural area. The potential impact of the improved first aid practice in the rural area. Reduction in the severity or severe injuries. With the improved knowledge and the resource, rural women can provide immediate and appropriate first aid, potentially reducing the severity of injuries and preventing complications. Enhance health outcome and community resilience. When women in the rural area are equipped with first aid kit skill, they contribute to a safer community environment and more resilient healthcare system. This preparedness could reduce the burden on the local health facility and improve health outcome of family and the community. The empowerment and the capacity building. Training rural women in the first aid not only empowers them but also help in the building a culture of health and the safety within the community. As key caregiver, their ability to perform first aid can foster in the community-wide commitment to a well-being. Ultimately, addressing the knowledge, attitude, and the practice of the first aid among rural women is a crucial for building a resilient rural healthcare system. Empowering women with first aid skill would not only enhance immediate response to a medical emergency but also promote overall health literacy and the community welfare. Thank you.